back in the hands of the people. You say, well, God, they can't afford that. We have to make it so they can afford it. So we want people that truly perform a good service, that truly do good quality work. They need to get paid, and the people, everybody, regardless of your ability to pay, or whether you have a job or don't have a job, you still got universal health care, both for maintenance and catastrophic. That's the whole point. It's all doable. Over here, just so you'll know, commercial and self represents only 1/8 of this $2.1 trillion. Only 1/8 of it ever comes out of the pocket of individuals in the United States. They only pay for 1/8 of the $2.1 trillion worth of health care. I'm telling you, it's great if you're the one that gets it for nothing, but it's terrible for all the ones that go to the hospital and can't even get care, and it's also terrible for the people that have to close their business and can't even supply the care because they can't afford to insure their offices or whatever in order to supply that care for them. Or if the hospital has to close and then it supplies care to nobody. My biggest question to you, the public, is how many of you have heard this before? I'll bet you none of you have heard it before. I'll bet you not a single one of you people out there who voted in elections, who think they're a Republican, who think they're a Democrat, who think they're for health care, who think like the President's plan, want universal coverage, want a single payer. I hate to insult the public, but I have to. What I'm trying to tell you is that all these things are doable. You're just told they are not doable. Universal health care for every man, woman, and child is possible. It can reduce the debt. It can make the system work better. It can give us a health care system that's even better than what we already have. And the other thing that will work is we can reduce the national debt. You can create jobs. You are never going to create a single job if the person that's trying to run that business is in debt. A debtor can't supply you a job. The point I'm making is that you want to be in control of your health care, and it should be a right for you to pursue that health care. But it is not an obligation for your fellow man to give it to you for free. You have to fulfill an obligation, and they, if they want to be paid, have to fulfill an obligation to you. It's a symbiotic relationship. It's not all for one and none for the other. It's not that way. It's not I get mine, you get yours. And it doesn't have, it shouldn't have anything to do with how much money you make. It has to do with what's fair, what is fair. And without going into taxation, I will tell you, without actually going into taxation, I will tell you that the money is there to solve the problems, but the money is not going toward the problems. The money goes everywhere else but toward the problems. I would say that's in the energy situation. I would say that was in the banking situation. All that money that disappeared in the banking problems went somewhere. Somebody got it, and somebody didn't. And I venture to tell you, the American taxpayer didn't get it, and somebody else did get it. And so what I'm trying to tell you, just like in healthcare, every American taxpayer, everybody living in this country, puts in enough money that they can have universal coverage. They deserve it, and they can have it. But they all have to play fair, and they have to play by the rules, as do the suppliers of that health care. I just wish I had people ask me questions, because I can usually work a lot better when I have people ask me questions. But how do I get the public to wake up and see what I have to offer? What I'm planning to do is set up a web page, and I'm planning to have on that web page the ability for you, the public, to get my book and download it. If you understand what I'm saying, you will be outraged at how you're being screwed. I want fairness. I don't want Republican or Democrat. I don't want rich or poor. I want it to be fair. I want it sounds like a radical left-wing thing rather than a right-wing thing. And perhaps that's why this book has been given to all the politicians on both sides of the fence and many of the news media, and nobody wants to talk about it. I don't know why, other than the fact that their vested interest must be against it. They feel that whatever the system's working well is working well for them, but they don't care about the rest of the people. The problem with getting things to you, the public, is this. The majority of people will never be sick this coming year. The majority of people, the fraction of people that will have a heart attack and be in the ICU is just tiny. And it's only those people that have worked for, say, 40 years and lost their job and had a heart attack. But that number is very, very small. So it's hard for me to excite you into taking care of those people because it doesn't affect you directly. But if people really turn around and they look around at all their friends, everybody knows somebody that's been affected by their inability to get health care. Or their decisions of where they work, or they seem a slave to where they work because they have kids to support and they have to work a certain job no matter how bad they don't like it, because otherwise their kids lose their insurance. What I'm telling you is this insurance that I'm talking about is yours to keep for your whole life, and you can take it anywhere you want, and it's yours. And where we come down to paying for it is if you make a lot of money, it's not a problem. If you make very little money, it's not really going to be a problem either, because the government's going to have to help you out. But they're going to help you out using a system that makes sense. If you're in the middle, you're the person that's getting crushed the most right now. You may work like a dog and then have a pre-existing condition and you can't even be insured. That's wrong. You want to be covered, and you want the best coverage that even the richest person has, because the dollars are in your hands. And so at the end of the year, if you make so much money, but you spent so much money on health care, that money that was spent on health care needs to be deductible. Clear and simple. Just like it is for the businesses, when they supply it to you, they deduct it. Why shouldn't you? And so I'm telling you, given more time, that I can probably convince you, if I had more time, that all this is doable. You should be outraged that it's not the way it's done, and everybody can have health care. And until you solve the health care dilemma, along with the national debt that goes along with it, your creation of jobs and all the unemployment and all the recession is never going to turn around. I repeat, it will never, ever turn around. The country's debt situation, the employment situation will never turn around until you fix health care, and you fix it with this kind of a format. It's a format that's based on fairness and equality, and not based on any one person monopolizing the system and gaming the system and making all the money. It will never get corrected. I repeat, the situation, employment, and the national debt will never, ever, ever, ever get corrected till you do these basic things. And if you do them for health care, you'll see that a lot of it has to do with taxation. Taxation determines behavior. In fact, you probably don't know this, but the word taxation, T-A-X, means to arrange. A taxidermist arranges the skin on a dead animal. The word T-A-X means to arrange. Well, when you arrange something, you are putting your hand in being involved in it, and you're going to have repercussions. You're going to have good things that happen because of the way you arranged it, but you're going to have bad things, unintended consequences. So tax law needs to always be reevaluated to evaluate it on fairness. It has to be based on that the taxes that are raised are necessary for a government to run. But as I've said before, government of the people, by the people, and for the people is for the people, not for business, not for government, not for insurance. It's for the people. The government is not supposed to benefit itself. The insurance companies aren't to benefit themselves. The business people are not to benefit. Who is to benefit? The people. The government is to run to benefit the people so that they can have the greatest prosperity. And prosperity would mean, how can you consider yourself prosperous if you're in debt and you don't even have health insurance. You're not prosperous. By definition, you're not prosperous. So, bottom line is, you want to remember that only the people pay taxes. And therefore, if you're going to arrange your life, which is what taxing does, you want it arranged so it benefits you, the people, fairly, and not the government, not business, and not insurance companies. Okay?